Make sure you go back and watch that program. Thank you, George, for sports. That's it for news today. We are going live to Parliament now. Joseph Opoku-Gakpo is standing by with some MPs to have an interaction with them. The big thing to expect today is the approval of that report from the Appointments Committee, and the House will be considering the approval of the report from the Appointments Committee on the vetting of the 4 nominees for Supreme Court. The MP for Insawam, Frank Anodombre, is delivering a statement on the floor.
As you have rightly said, very well researched, very erudite, and well delivered as well by the chairman of the Committee on Foreign Affairs. Mr. Speaker, he raises a very, very fundamental issue, an African solution to a global challenge which we are all grappling with. And Mr. Speaker, the matter to do with treatment, medication at this point is crucial, because we all know that as we speak, no vaccine has been found. The clinical trials have begun, the search is on, but no vaccine as of yet has been developed. Indeed, the experts are telling us that it may take some 12 to 18 months before a vaccine could be found. Some say it could even be longer. But we do know that the pandemic rages on, and that many, many countries are afflicted at this point. It has gone beyond a health crisis to an economic, a national security, a social, education, a psychological, traumatic crisis as we speak. We do know that quite a number of people are recovering, and treatment at this point is the only salvation in the absence of a vaccine. Countries are finding their own solutions so far as the matter of treatment is concerned. And Mr. Speaker, we do know that Western nations, for example, have been relying heavily on the drug they call hydroxychloroquine. We know that it's being used in France, in the United Kingdom, in the United States, just for treatment. The World Health Organization has warned that it's not a cure. It's just to help treat patients. The challenge that Africa and many poor countries have had, when you read the literature about vaccines, about medications and all of that, is that even when a vaccine is finally developed, the rich Western nations will often pay the pharmaceutical industries, and they will want to have it first. They will want to ensure that there is adequate supply in their nations before they think about other countries. And that is why last week, our president became the first president to sign up to a United Nations agenda to commit global leaders that when a vaccine is found, there should be equity, there should be fairness, there should be justice, so that all countries will have access to that. I salute our President Nana Addo Dankwa Akufo-Addo, for signing up to that global pact because of the history that we have had in this world. But Mr. Speaker, as I commend the President for signing up to that pact, African leaders must be urged to also look within for African solutions. There is this talk of the Madagascan herbal cure, which, as we speak, the Madagascan President, André Rajoelina, is promoting. He has sent Ghana some samples. Our Ministry of Information confirmed yesterday that it has been received and forwarded to the Food and Drugs Authority for testing. Its efficacy is being tested. We must commend our government for keeping an open mind and receiving that vaccine. And we urge the experts at the FDA to expedite the test. I believe that that is the way to go. And that is why I must salute the African Union, Mr. Speaker, for also keeping an open mind, despite the initial criticism by the WHO, by reaching out to the Madagascar authorities, receiving samples for the Africa Center for Disease Control. As we speak, the Africa Center for Disease Control is researching further into this Madagascar herbal treatment, which is being referred in some quarters as the herbal wonder drug, or COVID organics for short. So, Mr. Speaker, it is important that we invest in seeking a vaccine and also finding treatment for COVID-19. We should not always be at the receiving end. We must invest in science and research. For a long time, the African Union has urged member nations to spend at least 1% of GDP on science research. Unfortunately, we have not yet met that target. But as there is a race now for treatment, medication, and for a vaccine, African countries should come together and pool resources together. That's why 2 weeks ago, I was quite worried when the European Union led a vaccine contribution, financial contribution effort, a virtual conference, as they called it. They were able to raise about $8.2 billion. Sadly, when you look at the list of donors, no African country donated in that effort. You had even individual celebrities like Madonna, the pop star icon, donating about £1 million as I monitored the meeting at the time. The challenge is if we don't contribute to the search for a vaccine and other countries contribute, spend all their resources, again, the issue of fairness. Are they not entitled to at least show some, greater interest in taking a greater share of what comes out of it? So that is why we must also invest in our own solution. So this statement is very, very timely. I commend African presidents for keeping an open mind and welcoming the news from Madagascar. I noticed that other countries like Tanzania, Guinea, Liberia, Sierra Leone are all receiving samples to see how we can rally behind Madagascar in search for an African cure. But as we make this point, let us also be reminded, as the maker of the statement has said, that in Ghana, we've had centuries upon centuries of home wisdom, of herbal experts of repute who have held the fort. The challenge maybe has been that they've not been able to transfer the knowledge to succeeding generations, and the efficacy has not been documented over the years. But we have capacity as well. And as we speak, we know that the local herbal medicine practitioners are not too happy with officialdom. 3 days ago, I read in the news, they're complaining that they have sent a number of samples that their results have not been forthcoming. They are even asking for resources which have not yet come to them. I hope that as we show interest in the Madagascar wonder drug, we will also show interest in our home practitioners, our herbal medicine practitioners. Fortunately, we've made progress as a country in trying to improve the science. At the Kwame Nkrumah University of Science and Technology, we have a whole department now, at least over the last 10 years, that is seeking to research further, and certificate, and provide the clinical and scientific basis for our herbal treatment medication. So let us invest. Yesterday, His Excellency the President launched the $600 million COVID alleviation program for SMEs. I heard the President say clearly that the pharmaceutical industry will be one of the sectors that he will focus attention so far as the $600 million stimulus package is concerned. 600 million cedis, pardon me, 600 million cedis. We should see some substantial amount go into our local pharmaceutical industries and our herbal practitioners. We should support them so that they can help us with treatment. And who knows, a vaccine may come from Africa. Because if you look at the drugs that are helping so far, they are drugs that the experts tell us have a correlation with malaria. The drugs that help us fight malaria, like chloroquine, have been so far very successful in the treatment of COVID-19. Africa has been dealing with malaria for many, many, many decades. So if there is any continent that can come up with a solution, it should be Africa. Where we are lacking so far is strong, vibrant leadership and coming up with the resources, putting money behind this effort. I believe that if we do that, we will be able to find our own treatment, and who knows, probably a vaccine that the world will gladly welcome. So, Mr. Speaker, I commend the chairman of the Foreign Affairs Committee for this very timely statement, and I hope that our government will race against time to invest meaningfully in supporting our local herbal practitioners. Let us do away with the stigmatization and let's do away with the discrimination against them. Herbal solutions work, and herbal solutions can also be efficient in providing health care. So let us do away with that stigma, with that discrimination that often greets traditional medicine as against Western medicine. No one is inferior to the other. So let's be Pan-Africanists. Let's move to support the African agenda in this cause. I thank you very much for the opportunity to contribute to this statement.
Thank you very much, Honorable Video. One from the majority and the leadership have been advised. Yes, Honorable. Honorable.
Thank you very much, Mr. Speaker, for the opportunity to contribute to the statement made on the floor. Mr. Speaker, as you have rightly said, this statement has been well researched and has been well delivered. And I'd like to thank my honorable senior colleague. Mr. Speaker, I'd like to touch on a few more areas that I think that as a country we should focus on. And Mr. Speaker, I'd like to talk about the production of these masks that we are wearing. I'm sure that we all drive by the roadside and we see a lot of people selling some of these masks that have been locally produced. Mr. Speaker, I think that it's very important that we find a way of making sure that the masks that are being sold by the roadside are passing through the proper standards, and that individuals that buy these masks are not going to be exposed. And that should help the process. It should also help local industry. Mr. Speaker, still on the mask, I remember that when you gave the order for us to be wearing the mask in this chamber, some of us were wearing the mask the other way around. And so it's also very important that there's serious education as to the proper wearing of these masks that are being distributed to help manage the situation. And Mr. Speaker, the third point that I would like to make, and again, this is in support of the directive that you gave out yesterday about us, members of parliament, making sure that we know our status of COVID-19. I realized that downstairs in the foyer, following your directive, there's a team that is downstairs and checking the individual status of parliamentarians and members that are working in this house. I'd like to commend you for this action. I'd like to commend my honorable members to ensure that we all go down and we check our status. Thank you very much, Mr. Speaker, and together let us stay safe.
Thank you very much, Honorable Minority Leadership. Yes. 19 is topical, and many people, I won't remove it. The majority leader wants me to remove mine. I won't do that. I am going to speak like that because that's the best way to demonstrate that you wear the mask. Now, what you see, people, some call it nose mask. When they are calling it nose mask, meanwhile the thing is down and the nose is exposed. And then you have a mouth mask or face mask. So we now have three. It is, what is it you should do? Cover your nose and your mouth. If they are not covered, you are not safe. It is through these two holes, the mouth and the nostril, that the droplets would escape and affect other people. Whether you are suffocating or not, please make sure your nose is covered. Make sure your mouth is covered. Now, importantly, there are many things that we can do as a nation to be able to combat this. For the vaccines and the medicines that we are talking about, the danger, however, is about the fake ones. People want to take advantage of the crisis to sell anything. You will look at the social media and there are so many remedies, some of them very dangerous remedies. And yet, because people are panicking about this disease, they are likely to be patronizing such products. It is sad that people who are deliberately propagating these remedies know very well they are not effective. Most importantly, as a country, we have to look at our testing regime. What we do, I will recommend that wherever you have a potential source of the spread of this pandemic, you isolate, trace, check, and test it so that you can confine it to a particular area. Once you identify the center, the epicenter of that spread. Otherwise, we are likely to be tracing people who you suspect to have come into contact with other people. But more importantly, those who are in crowded areas. So I get worried when I look at the market situation. Almost all the markets, people are talking about social distance. Meanwhile, you look at them, there is no social distance. The way our life has been lived, it is not easy to enforce social distancing. We must make extra efforts to do that. Otherwise, the spread cannot be. Indeed, from the past few days, there's been talk about opening up more for the restrictions to be relaxed so that many more activities can take place. One of them is whether we should begin to open up our churches and the assurance that we will maintain social distancing whilst worshiping the Lord, and also schools to be open. Again, my position on this matter is very clear. We have to hasten slowly because in France, when they opened the schools, they've just closed them again. It means that this disease, nobody knows exactly how we can manage it. The scientists are still struggling to identify the true nature of it and how it can be confronted. And therefore, if we rush and release all of us into a marketplace situation where everybody is doing what he wants to do, we are likely to have an increase in the spread of this disease. Mr. Speaker, it is not good, but I'm very happy, and I commend you also, that we have done the test. I hope that the test will come quickly and we will know those who should be isolated and those who should continue to come. Now, the isolation and quarantine people is a problem. Where do you have the facilities? If about 20 of us who are sitting in this room have it, where are you going to quarantine them? So I believe that, more importantly, government should take more steps. Government should not be interested in good figures, because they release the figures and praise the figures, oh, there is a decline, when indeed, cumulatively, the numbers are increasing. Those who are not mathematicians, those who can't even do arithmetic, they find these discussions very, very unfortunate, because it creates the impression that things are okay. As was mentioned by one of my colleagues yesterday, we should not pretend that the thing is over. It is not. It is still present, and it's a threat. I believe that all of us should take caution in what we do. Those of us who are elderly people, we stick to stay in our homes and come to only duties when necessary. But the younger ones also think they have more immunity. I can trust them. But you see, as for immunity, it can easily drop if you expose yourself unduly. So general advice, stay home if you can, work from home. But in the case of Parliament, we are here and we are working for the people of Ghana. Thank you very much, Mr. Speaker.
Thank you very much, Honorable YIELEH. And finally, the majority leadership, represented by, yes, Honorable Minister.
Thank you very much, Right Honorable Speaker. I'd like to commend the maker of the statement for his well-researched work on where we started from and how far we have come. Mr. Speaker, it is very important to state that in Ghana, we have shown a lot of seriousness when it comes to the management of this condition, the COVID-19. In fact, in Ghana, the incident commander, that is the leader of the whole team, is the president himself. It is not the case in other countries. And there is good reason to be happy when your president is the incident commander. It helps in the mobilization of resources and in the commitment of all government agencies and individuals or public officials towards the fight. And that is very instructive. So, Speaker, when all is over, the story will be told also of the legacies of COVID-19. We have started seeing the legacies already. This is a country that had a total capacity of only 1,500 tests a day for nucleic acid amplification test, that's PCR test. But due to COVID, today, our capacity is about 5,000. You need this test to confirm even CSM outbreak, CSM infections. Absolute confirmation is done with PCR. And I remember when I was in the Upper West region on the tour, I was told that sometimes you have to wait for weeks to get a PCR done in Tamale. Now that we are scaling and ramping our testing capacity, going into the future, some of these things will be addressed. Mr. Speaker, it is important to state that all ministries so far have collaborated with national security in terms of ensuring the integrity of our borders to make sure that you don't have people coming in with the risk of infecting citizens in this country. It is also important to say that the Foreign Affairs Ministry has been very instrumental in partnering embassies, our missions abroad, to see how to support the cause. Mr. Speaker, I am impressed also with the attitude and output of the Ministry of Health, being very diligent when it comes to coordinating the supply of PPEs and making sure that the supply chain is kept. Mr. Speaker, let me take this opportunity to explain a few things. Nobody would have more than enough of PPEs, Mr. Speaker. Even if you give a facility all the PPEs they require, only within a week, they will call you and tell you that it is inadequate. And the reason is simple. These are items you use and discard. They are consumables. And so what we must speak to is the supply chain that will ensure that adequacy levels are maintained for a long time. And that is very important. Mr. Speaker, when you have a disease, it is possible that in its early stages, it can only be a medical problem. But if you have a disease that affects people in their millions and comes with stopping activity and businesses, it's no more a medical problem. It turns into a national security problem, it's a social problem, it's an economic problem, and everything you can think of. And immediately you have such a situation, you must be careful how you assess the whole situation. And I believe that so far, this is a country that is doing well to make sure that we win the war against COVID. On herbal treatment, Mr. Speaker, there is a principle in medicine, which is the principle of do no harm. You don't want a situation whereby you introduce a herbal medication with the hope of saving lives, only to harm some people. And so in as much as we want to support African innovation and invention, you want to make sure that you are patient to test some of these medications. And I'm happy that the FDA is looking at it. If it's efficient, we'll go with it. If it has issues, we'll address it. In conclusion, Mr. Speaker, inevitably, we'll be going back to life, to normal life with time. The only thing is that there will be measures and guidelines given to all of us to reduce our risk of getting the virus. Life is about risk reduction. You cannot have risk avoidance. And so, Mr. Speaker, all other countries are going back to normal life, but with the guidelines of social distancing, wearing a face mask, cleaning your hands and all that. I think when we respect the protocols, with time, we can get back to normal life. I thank you for the opportunity, Mr. Speaker.
Thank you very much, Honorable Minister, for your very insightful conclusion. We have another very important tribute for an international judge of Ghanaian origin who has passed on. Judge Dr. Thomas Abuaji Mensah of University of Ghana fame and elsewhere. We'll move back to statement later to be decided over by the Honorable First of the Speaker. But in the meantime, we shall take the matter in which the First Deputy Speaker will move the motion number 6.
Mr. Speaker, I rise to move that the House adopts the 20